More than 5% of Hoosiers have abused prescription drugs. The data from the Substance Abuse and Mental Health Services Administration shows it's a growing problem, particularly among healthcare workers. The term used to describe it is healthcare drug diversion. It occurs when hospital workers steal medications from a facility. As Barbara Harrington reports, loopholes in the law are making it difficult for law enforcement and hospitals to combat the problem.
So this one here.
Rigo Garcia dedicates his life to helping others.
The first time I met him, he was pre-opping a patient, and just his compassion for others and the way I saw him pre-op his patient, and I knew right then and there that he was genuinely in the profession because he wanted to care for people.
No one imagined the highly successful certified registered nurse anesthetist would need some help himself.
I was very, very driven professionally, very driven with my family.
But 4 years ago, Rigo severely broke his ankle. His doctor prescribed Vicodin. But even after the pain went away, Rigo kept taking the drug every day after work. At his worst, up to 12 pills in just one night. And it turned into a habit that proved nearly impossible to break.
When I did go back to work, still on prescription medications, I would just not take them while I was at work. I would take them, I would run home to take them. I would take them before work, on the weekends, anytime I could. This is Dougie the drug dog. Dougie's a real dog.
Rigo's story sounds familiar to many of the people in this room. They're attending a training session hosted by the National Association of Drug Diversion Investigators, hoping to learn more about how to prevent and recognize drug diversion.
Diversion happens at every facility across the country that handles controlled substances. It's universal among institutions.
Kimberly New works as a controlled substance security consultant. She helps hospitals develop policies to prevent and recognize diversion. She says when providers abuse prescription drugs, they're putting everyone at the hospital at risk.
Patients can be harmed in a number of ways by a diverting healthcare provider. If they're a direct care provider, they may be working impaired and may actually render incompetent care to a patient, and the patient may be harmed.
It's difficult to put a number on how often that's happening because some facilities aren't reporting the problem. Instead, they choose to discipline employees themselves or ignore the issue altogether, a tactic police say isn't helping.
I think that majority of non-reporting is done deliberately. And I think some of it has to do with media. They're concerned about media attention, they're concerned about liability, lawsuits, all those things that I get that, but you know, when you don't report or you delay it, the liability and the issues can be much, much greater than just doing what's right when it happens.
There are regulations in place that require people to report instances of drug diversion at their workplaces, but it's hard to enforce. Columbus Police Department Sergeant Jay Frederick says compliance would be higher if regulations were tougher.
There are some things in place, but there's still a lot of loopholes. So it would be good to see the federal government lock that down, address this diversion in the healthcare field as a significant issue, and lock down some reporting requirements.
But in the meantime, Frederick says increasing awareness can go a long way in fighting drug diversion. He says healthcare providers are often nervous to ask for help or report others who may need it because they don't know the consequences. In Indiana, if professionals admit their addiction and successfully complete treatment, they can have the criminal charges removed from their records and their licenses can remain intact.
There's not many professions or jobs where you can own up to the addiction issue, go right into the treatment that's going to get you better, get you healthy, but you can keep your license and you can keep on practicing.
That's something Rigo didn't realize when he was struggling with his addiction. It took the hospital CEO confronting him and giving him an ultimatum before he got help.
If I knew personally what correct steps I could have taken, I would have done something a lot sooner. But the bottom line is I didn't know what steps were available to me at that time. I didn't know that there was a treatment center that I can go to and my job would be safe. And the thrills of round one of the addiction.
It's been more than 4 years since Rigo's abused pain medications, but it's still a part of his life he doesn't hide. He still works as a CRNA, but spends his spare time sharing his story with others, hoping to make a difference.
To tell us more about why this problem exists and what's being done to fix it, reporter Barbara Harrington joins us now. You know, it's not something you really think about when you're in the hospital. Your mind's on much other things, but what are healthcare workers doing to help divert themselves from taking that medication?
So when they're diverting these medications, Joe, what's happening is sometimes they're taking a prescription that they give to someone, a patient, and taking some of those pills. In some cases, they may be injecting a syringe medication to themselves and then replacing that solution with something else and then passing it on to the patients. And they have a lot of access to those medications, so it's risky.
So having an impaired doctor isn't the only risk that this possesses.
Right, when they're replacing some of those drugs with, say, if they take a syringe, it could be water or saline solution, they're giving that to a patient who then isn't getting the medication they need, and then they could also, with the syringe, be exposed to bloodborne pathogens.
Now, you said that doctors can actually get their licenses back?
That's something that surprises a lot of people who don't know about this problem, but if they go through the right steps, like treatment through a professional facility, and they stay sober, they don't relapse, then they can have their license remained intact, and in some cases, criminal charges, because diversion is a felony, those can be wiped from their record if they complete that treatment successfully.
Now, how big of a problem is this? I mean, one is too many, but kind of, do you have an idea of?
It's really hard to get an exact number on that. It's because, like we heard, hospitals aren't all reporting this, but Rigo Garcia, the nurse who was addicted and has gone through this, he said that about 600 nurses through the state are using the Indiana State Nurses Assistance Program. It's called iSNAP, and going through treatment. It's a huge problem.
Okay, thank you very much, Barbara.